games-based learning, what is it? Good question. Right, well, really what it does is it integrates the key benefits of gaming techniques with embedded learning psychology. So it is very much specifically designed games to provide some type of training or educational purpose. And people have latched onto this because of the immersive environment of games. People learn through games in a stealth way. They don't know they're learning. Basically, they take in information, they learn things without actually knowing about it. And when you're looking at the communities that you're trying to engage with, typically, we heard the average age of a gamer now, you're actually getting a broader and broader reach in terms of people that you're trying to interact with. So why is health such a huge opportunity? The whole games-based learning opportunity has been around, been talked about for about almost 10 years now. Really, last 6 years it's been coming to the forefront. But it's not quite taken off. And it's really at that tipping point now, my gut feel. I think health is one of these areas where it could be a real explosive opportunity. The reason is there's so many different people that you're trying to target. You've got your professional healthcare workers, you've got your patients, and you've got your general public. All of them have different requirements, and you're trying to teach them different things. Obviously, it is quite a distributed network of people that you're trying to train. So therefore, using online delivery is a cost-effective way of doing that type of training. And there is e-learning tools being used at the moment. But e-learning, if you've ever done any e-learning yourself, you'll know it's click, 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 right, tick the boxes and that's you done. It's not engaging. There's not really much benefit from reading a book over an e-learning approach, unless it's an interactive e-learning approach. It's been well proven that using games can help people who are doing surgical procedures to help their accuracy, help their delivery in the treatment. And it's not actually about the surgical procedure, it's about actually controlling. And they've had some really positive responses in that in terms of the accuracy that comes out. And then it can be used to reach difficult audiences. So this is an example which is using mobile. So one thing I think is very clear from this is a broad range of opportunities, but it's also a broad range of delivery expectations, whether that's being the platforms, PC, or it being mobile. So this Freedom HIV AIDS, a very, very successful launch as well, basically to get access to people that typically do not relate to health training. So again, they've got about 5 games which help you to understand more about HIV/AIDS, how it spreads, how you can prevent it, etc. And you'll see the downloads there, fantastic. And again, it's areas that have not typically been able to be accessed. Let's choose the game that's appropriate to your audience. Make sure there is a learning message and it's properly conveyed through the game. So just a summary, I think this is an excellent opportunity for games developers, because what you're talking about is they're not particularly expensive games. They have got huge different targets and markets you can go after. There is a huge crossover of skills. You can see yourself from that respect. What you must obviously do is make sure, as I said, there is a learning point to it. So that's working with subject matter experts or working with people who know the message they're trying to get across. So a range of different platforms. Doesn't matter whether you're developing for the Wii, Xbox, PC, mobile. You have an opportunity here because you're trying to reach that audience. I think the other thing that's really coming about now is the social media games and how that transfers to the health environment. Real opportunities. There's a couple of people dabbling. I know there's a Scottish company dabbling at it at the moment, but I think that's, again, something that's really interesting.